Hey, thanks for giving me a call. I'm very glad that you called. Um, let's just get right into it. It's a lot of information to cover, and I want you to understand a little bit more of what's going on with your loved one. I know that it can be very scary. Let me share my screen here. It's especially scary when considering how it is portrayed in in the media. We're gonna start here. Hulu has a show called Dope Sick, which is kind of a sobering representation of what goes on. Usually it's talked about in a moral manner, saying that the person is bad for using the drug or becomes bad for using the drug. And it is a lot more complicated than that. So I'm glad that we're talking about this. Opioids are a class of drugs that includes illicit or even legal drugs like heroin, or legal drugs like pain relievers such as oxycodone, hydrocodone, codeine, morphine, and a lot of other ones. It affects over 2.1 million in the United States alone, and it's definitely a worldwide issue. So first, what makes a person more susceptible for usage? Well, studies have shown that people who have a genetic disposition for alcohol use disorder may also have the same genetic disposition for opioid use disorder because of how it affects the brain's reward system, which we'll discuss a little bit more shortly. There are also the emotional stressors like loss of housing, employment, loss of children, lack of freedom, poverty that can further push a user to try to numb the pain. They don't have the coping mechanisms to deal with these emotional stressors. So it starts the vicious cycle, which we'll talk about more. So the way that the brain affects, the way that the drug affects the brain affects the body, affects the brain. And so the chemical runs through the bloodstream, whether it's taken intravenously or orally. And it gets into the special proteins called mu opioid receptors, which are opiate sensitive brain cells. And they mimic the same feelings of pleasure that you get from eating your favorite chocolate or having sex. Opioids like hydrocodone or oxycodone are prescribed for pain, but the issue is that when there's no more pain, then the person just wants to have that feeling, and that's written in the brain. So it activates this the brain circuit that is activated by opioids in the mesolimbic reward system, which is here, causes the ventral tegmental area, which is this VTA right down here, to release dopamine, which is a pleasure neurotransmitter, into the nucleus accumbens and affects this prefrontal cortex. Now, our prefrontal cortex has to do with our memory, with our organization, how we organize that information for memories, and how we respond to it, like making decisions. So it can definitely directly affect impulsivity, compulsiveness, and a person's planning abilities. This is where you start to see the issues of criminal behavior or other such type of things, because the person just wants to chase that feeling of getting high because it makes them feel good. Now, at the same time that this is happening, the brain is imprinting the feeling, and that is the base, that is the cause for triggers. So later on, when they see the same person that they've used with, or the same location that they've used in, or even just seeing a needle, can make that person feel like using the drug, and it's a vicious cycle again. Now, um, sorry. Another thing that affects in the body is that it increases the cortisol level, which is a hormone that has a lead role in stress response. So at the same time it does this, it also I'm sorry, it also changes the baseline for dopamine and noradrenaline. So this cortisol and noradrenaline uh, are changed. So now it lowers the body, how it feels, it slows the breathing, it makes them feel kind of drunk and good because of those dopamines again. The noradrenaline is calming the body, the dopamine is feeling good, and it changes the baseline for how the brain later reacts to other things. So, whereas before you really liked eating that chocolate, now that chocolate's not enough. Your brain is elevated to just want this extreme effect of the getting high. So it's, again, it's a very vicious cycle, and it is a little complicated. Other ways that it messes with the body is that it wreaks havoc in the forms of malnutrition and dehydration. The vitamins, minerals, carbohydrates is changed in the body because the person just doesn't care for it as much. And uh, so when it's a two-edged sword, when the body isn't healthy because it's not getting all the things it needs, the brain isn't healthy. So now the brain's not healthy, the body's not healthy, the body's not healthy, the brain's not going to be healthy. It causes things like restlessness, irritability, impulsivity, and proneness to violence. Anxiety, depression, sleepiness, and panic attacks can also be a result of this dehydration and malnutrition alone, even without drug use, of course. So you can just imagine how much worse it can get for those who are using drugs. Another important factor in the body is that people who are sharing these drugs using needles are very, very much prone to getting hepatitis C or HIV, which is another whole life-threatening issue of itself. Now, why do people have a certain reaction with withdrawal or when they try to stop? The issue is that the noradrenaline going through the body, it usually regulates wakefulness, breathing, blood pressure, and alertness, and the opioid molecules that link to the mu receptors on the brain cells in the locus coeruleus, which is that bottom part down there, changes, I'm sorry, prevent the noradrenaline and makes the person drowsy, makes them slow breathing and have low blood pressure, like I said earlier. And because of this, when they stop taking the drug, now they're sick. They have excruciating symptoms of jittering, anxiety, muscle cramps, diarrhea, because those neurons were changing their activity to match that level of the noradrenaline and everything. So it's again, it's a very vicious cycle. So then it becomes down to, let me get out of this over here and talk to you so we can talk about treatment and how you can help. It comes down to drug therapy and social support. Methadone imitates the same mu opioid receptors in the brain, just like the illicit drugs, but it's changed in the duration that it's of action in the body. So it can help reinforce those feel the sorry, it can help reinforce a healthy lifestyle as the person is no longer doing criminal seeking behavior to just get the drug. They have this drug, they're looking for support, and they can get there and it slowly be taking off of the drug altogether. Very slowly, and sometimes they might not even be able to, but they can get back to a normal lifestyle. It's also important to note that social support is a huge thing in the long end. That is what you can do to help. A systematic review of over 5,000 trials show that social support very much strengthens the outcomes of recovery. And there is a different study done in New Mexico that has a happy ending, that the participants in the study that were originally not proud of those criminal behaviors that they originally had because of all these things that are happening with the triggers, with the changed baseline and everything in the brain and the body. They started recovery, they were getting there, and at the end they started their own outreach program in their community to inform the youth of the dangers of opioid use. And starting, basically you want to break that vicious cycle of the abuse, of the triggers, of the chase, and replace it with something that is stronger and healthier, which it is doable. You as a family member, as a friend, can put yourself out there to show them that you care and that you want to be there. um, encourage them to do social support groups or to get more informed, work with their doctors to get back to a healthy place. It's going to be hard and it is long. So I very much commend you for calling me, trying to talk this through. And if you ever have any questions, please let me know. Again, be careful out there. You know, the medicine field is always changing. And it's always important to ask questions to your doctor and do not be afraid to be healthier. Now, thank you so much for joining me. If you have any questions, please give me a call. Again, thank you.